What if we could load cancer cells with a tiny target and then fire an invisible beam that only detonates inside those specific cells? That's the core idea behind Bnct, Boron Neutron Capture Therapy. It's now used clinically in Japan and is rapidly entering clinical trials across Europe and other parts of the world. I went to Taiwan for my own therapy. On my way there, my friends at Taichung VA Hospital invited me to their department when one founding father of Bnct therapy from Japan visited and gave them a talk. I want to share this topic with you. Today, I'll explain exactly how this two-step therapy works, who might benefit from it, what the treatment day looks like, and how it compares with standard radiation. The idea in 1 minute. Bnct is a clever two-step therapy that brings together biology and physics. Step 1. Prime the tumor. The patient receives an IV infusion of a boron-rich drug. The most common one is called borofalan, 10B. It's a modified amino acid that's designed to accumulate much more in fast-growing cancer cells than it does in normal cells. Step 2. Flip the switch. Once the drug has settled in, we shine a specialized neutron beam directly at the tumor. Here's the magic. When a neutron hits a boron 10 atom inside the cancer cell, it triggers a tiny, powerful nuclear reaction. This reaction instantly releases two highly destructive particles, an alpha particle and a lithium nucleus. The crucial part is that these particles have an ultra-short range, about the width of a single cell. That means the destructive energy stays mostly confined to the boron-loaded cancer cell, sparing the healthy cells right next door. Why Bnct is different? Think about conventional X-ray or even proton radiation. These therapies send a dose through tissues to reach the target. Bnct takes a completely different approach. It tries to put the dose source inside the tumor cell itself. That difference is the key. The biology, the boron uptake, and the physics, the neutron capture, work as a pair. If the drug successfully concentrates enough boron into the tumors and avoids building up too much in normal tissues, Bnct has the potential to deliver an incredibly high cell-level dose to the cancer while actively sparing nearby organs and sensitive structures. Who is Bnct for today? As of now, Japan has taken the lead. They've approved an accelerator-based Bnct system and the boron drug, borofalan, 10B, for specific cancers, inoperable or recurrent head and neck cancers. Real-world data coming out of Japan suggests Bnct can be highly effective in controlling tumors for patients who have limited options left after receiving prior radiation. Beyond Asia, the therapy is expanding. In Europe, centers like Helsinki University Hospital have begun treating patients on clinical trials with accelerator-based Bnct. Globally, studies are currently exploring Bnct for challenging diagnoses like glioblastoma, a type of aggressive brain tumor, as well as melanoma and other difficult-to-treat sites. What a Bnct day looks. So what does a treatment day actually feel like for a patient? Here's the patient journey in plain terms. Before treatment, you'll have a planning phase involving imaging, any necessary dental or skin checks, and a planning session to precisely map your anatomy and the tumor's predicted boron uptake. The infusion. On the treatment day itself, you receive the boron drug via IV. This usually takes a couple of hours as the drug circulates and concentrates in the tumor. Beam time. You are positioned very carefully in the treatment room. The neutron beam is turned on, usually for tens of minutes. You don't feel the neutrons, and the team monitors you closely from the control room. Afterward, you're observed for a short time, and in many cases, you go home the very same day. Benefits and limits. Let's break down the potential benefits and the crucial limits of Bnct. Potential benefits: microscopic precision. The lethal particles only travel about a cell's width, delivering an intense dose right where the boron sits. Single-day treatment. Unlike weeks of daily X-ray or proton radiation, Bnct is often delivered in a single, highly focused session. An option landed after prior radiation. It can be uniquely considered for recurrent head and neck cancers after patients have already reached the dose limits of conventional radiotherapy. Limits and caveats. The most important factor is drug selectivity. Bnct success depends almost entirely on getting enough boron into the tumor and avoiding too much in healthy tissue. Access is also a major hurdle. It's only available at select centers, and insurance or coverage varies wildly by country. Finally, there are side effects. These can include skin and mucosal reactions, swelling, pain, and temporary changes to lab work. Head and neck cases may specifically see oral or throat soreness, skin redness, or lymphedema. Your care team will always review your personal risk profile with you. Bnct compared to other radiation. Think of photons, X-rays, and protons as delivering an outside-in dose. We precisely shape the beams to avoid vital organs on the way to the target. Bnct, by contrast, is an inside-out dose. The neutron beam is just a harmless trigger, but the real punch happens only where the boron is concentrated. It is absolutely not a replacement for all radiotherapy. Instead, it's best viewed as a highly specialized option for tumors that are hard to treat or have been previously radiated, and its full potential is still being explored through a range of clinical trials for other cancer types. Who should ask about Bnct? If you or a loved one is dealing with recurrent head and neck cancer, especially after prior radiation, or if a glioblastoma is being evaluated at a major research center, it's worth asking your oncology team 3 key questions. Is Bnct available locally? Do I qualify for a clinical trial? You'll want a center that can evaluate boron uptake and safety, deliver accelerator-based neutrons, and coordinate a multidisciplinary plan that includes surgery, systemic therapy, or palliative care when needed. Key takeaways. Let's quickly recap the essentials. Bnct is a targeted therapy that uses boron-10 and a neutron beam to create microexplosions inside cancer cells. It is approved in Japan for certain head and neck cancers and is actively being tested in clinical trials across Europe and the rest of the world. Its greatest promise is for challenging cases where standard options are limited, such as after previous radiation. Remember, it's not magic. It relies entirely on the successful biology of boron uptake and very careful patient selection. Call to action, CTA. If this deep dive into Bnct was helpful to you, please hit like, subscribe, and share this with someone who might need to see this information. Drop your questions in the comments below. I'm planning a follow-up video to cover common Bnct FAQs, things like drug dosing, imaging techniques, and how centers actually plan the treatments. Thanks for watching.